afternoon. I want to share with you a very special thing that is called the No More Hospitalization. It may scare you, but it is a true. Now let me share with you, because I graduated from 1966 from Nanak Medical College and went to United States in 1967. Did my internship in United States in Detroit, and also did my residency in general surgery and the urological training. In 1971, I went to practice in Onaway, Michigan. And there was a small hospital. I was working with another older doctor, and I was at that time 28 years old. People who get chest pain, I know they got a heart attack, I treated them at home. I went to their home, talked to them, take their history, physical examination, blood pressure, and so on, and pulse. I did not do the EKG, but by listening, I know that he or she got a heart attack. And I treated them at home. And basically, I treated them like an intensive care unit. That means I gave them a fluids, apple juice, diluted with water, every day for 3 days. I went to see them every day, take their blood pressure, pulse, and discuss with them, and told them that they can do what their body allows it. Eat them after that, start feeding them what you call regular food, specifically oatmeal in the morning. I learned this because when I was in medical school, during my internship, one time, my rotation when it was in cardiology, that was 1966 of November, and there a man comes from the village who had a heart attack, anterior myocardial infarction. We put him in the hospitalization in the Indian hospital, and the doctor, my senior consultant, told him to put him on a bed rest. Same night he was admitted. Morning, the nurse called me and she said there's a bronchial asthma patient. I went there, checked a bronchodilator, and while walking I see this guy 4 o'clock in the morning who had a heart attack. He's doing his push-up. I didn't bother it because I just graduated from Nanak Medical College doing my internship, and he was doing his push-up. I went back, went to sleep. In the morning we had a grand round, and I told the professor that this is what he was doing, that he was doing his push-up. He says, "You are a total idiot and you should tell this guy to be a complete bed rest." I come back, I told Ramu that you should be totally bed rest, otherwise you can drop dead. Well, Ramu in the evening took his IVs out and went home. And after a month, we were posted in the same village, and there he told us, "You are not a bunch of doctors. You don't know what doctor he is." They had a Hakim in their village, and they told us to leave their village. But we had a dispensary there. Finally, I requested him, and he let me stay. So since I seen that person, the body has a self-induced healing. I had many other incidents during my medical college. So when I really went to the practice in 1971 in Onaway, Michigan, when I treated these people, because there was no stress, they were with their family, and they live with their heart attack, normal, their life. Then I moved to Zephyr Hill, Florida, 1974, and I must have treated hundreds of people at home. All this ICU or intensive care unit has come because of the Medicare in the United States. Of course, we should respect that. People who have an operation, people who had a major surgery, we do intensive care unit and ICU, we need that. People who have accidents. But again, we are living in a very modern society, and the Medicare system, which has come from United States, which started in 1965, and now it has gone so far that the pendulum has gone against it. It has to change. Medicare transformation has to be done. People do need hospitalization, there's no question about it. But there are many, many people who don't need that. Now, I don't mean that you should not go to the hospital if you're sick. You make your own decision. Make sure you go to the hospital, consult your doctor. But respect your body. Pay attention to your body. Become responsible for your body. We do need hospitalization, but we don't need unnecessary. I request you, all of you, because I've got a new book called The Cure Cancer Naturally at Home. And if you read this chapter called The Awakening by the Master and learn how to take care of yourself, you may not need a hospitalization the rest of your life. But make sure you work with your family doctor or work with your health practitioner so that you get the best result. I wish you should all buy this book from Amazon Kindle or from a website. I wish all of you a happy day, healthy day. God bless. Namaste. Amen.